In the midst of an unprecedented global pandemic, one man has been blamed by the authorities of a country for almost half of the coronavirus cases. But is it really possible for one individual to be responsible for half of the positive cases in his country? With around 2,600 cases and 11 deaths till July 2020, the island nation of Sri Lanka has been quite successful in containing the spread of the coronavirus. However, for the past month, one individual, dubbed as Patient 206, has been blamed for being a super spreader in the country. It all started in the small town of Jayala, 19 km north of the capital Colombo, where Prasad Dinesh worked as an auto rickshaw driver. He was a known thief and had a history of being involved in petty crimes. On April 5th, he was caught stealing coconuts from a nearby village and was handed to the police. He was running a fever and had sustained injuries to his leg during the theft, so he was admitted to the hospital where he tested positive for COVID-19. All the people who he had come in contact with, including his neighbors, friends, and the policemen, were ordered to self-quarantine themselves, but many of them objected. The Sri Lankan Navy had been deployed to help health workers, and numerous sailors were sent to the small town. 16 people in that neighborhood tested positive, and after a few days, 30 of the sailors too. Many of the sailors being deployed in different parts of the country, different clusters began to be formed. There were 3 prominent clusters with over 900 naval sailors and 250 people testing positive for COVID-19. All of them were linked to one person, Dinesh. However, he vehemently denies these charges, saying that he cannot be held responsible and that he is being used as a scapegoat by the government. Sounds too far-fetched? It may not be so. You see, the reason Dinesh was stealing those coconuts in the first place was to sell them to get the money to buy heroin. Sri Lanka has been cracking down on its war against drugs. It even brought back the death penalty for narcotic-related crimes in June 2019. There were even reports stating that hangmen were being hired for just one purpose: reducing the amount of drug trafficking. It is common practice for drug addicts to be shunned. But in Sri Lanka, the problem has been increasing to such new levels that the government has been resorting to extreme measures. This is why there is a possibility that a known drug addict like Dinesh is being made the face of a deadly viral outbreak in the nation, all in the hope of also tackling a different kind of infection. What remains to be seen is the authenticity of the claims by the government on patient 206.